Hi, my name is Lel Lebanov and I'm going to talk about late clinical development. In the phase 3 clinical studies, there was a Gemini pivotal trial, which was a multi-center randomized open-label 42-week study with 337 patients designed to evaluate the efficacy and safety of Imveraze 500 ritonavir versus lopinavir ritonavir. These treatments are given at the approved twice-daily dosages in combination with two nucleoside reverse transcriptase inhibitors in treatment-naive adults. Gemini enrolled 337 patients from Canada, France, Puerto Rico, Thailand, and the United States. Of note, the baseline characteristics of patients enrolled in the Gemini study indicated they had more advanced disease compared with patients in several recently published trials. The data show that boosted Imveraze 500 was not inferior to lopinavir ritonavir with 64.7% and 63.5% of patients treated with Imveraze ritonavir and lopinavir ritonavir, respectively, achieving undetectable HIV. A similar number of patients in both groups, approximately 73%, achieved undetectable HIV of less than 1,400 copies per milliliter of blood. Furthermore, the rate and extent of increases in CD4 counts were comparable in both groups, with a median increase from baseline of 178 for the Imveraze ritonavir treated patients and 204 for lopinavir ritonavir patients. Finally, the results demonstrate that there was no statistically significant difference in the number of virological failures. Primary endpoint in this study is the number and percentage of patients with a viral load of smaller than 50 copies per milliliter at week 48 based. The data shown that 64.7% of patients treated with boosted Imveraze 500 achieved undetectable viral load. Second endpoint time course of virological suppression, time course of CD4 cells increase, and safety as assessed by clinical and laboratory adverse events, serious adverse events, and deaths. Safety was noted that 48 weeks of ritonavir boosted Imveraze therapy was associated with better triglyceride results. Approximately 1.9% of patients in the ritonavir Imveraze group had triglyceride level 2 times the upper limit of normal upon entering the study. After 48 weeks, the rate dropped to 1.4%. As for cholesterol, the proportion of patients with elevated total cholesterol levels after 48 weeks was 31% in the ritonavir Imveraze group. Rates of elevated bad LDL cholesterol, however, were higher in 34% of the patients. The research also said there were fewer cases of diarrhea among those treated with ritonavir boosted Imveraze, 17%, compared with those taking lopinavir, 27%. It is worth noting, however, that most patients in the lopinavir group began therapy using the older gel cap formulation of the drug, which is known to have a more pronounced effect on the gastrointestinal tract than the current tablet version of the medication. Pharmacoeconomic trials have shown that Imveraze have considerable importance because Imveraze offers an effective treatment to control the virus with significantly smaller negative effects than the most commonly prescribed protein inhibitors. Also, Imveraze price on the market is not the highest or the lowest compared with other antiretroviral drugs, so it is another advantage of Imveraze. Thank you for your patience.